DocTalk is brought to you by Multimin USA, manufacturers of Multimin 90, Sure Trace Mineral Supplementation by Timed Injection.
Hi there folks, welcome to the show. Dr. Dan Thompson here, and welcome to another episode of DocTalk. We have an exciting show for you today. We're going to talk with Dr. Bob Larson, who's the Coleman Chair here at Kansas State University's College of Veterinary Medicine. We're going to talk about a new tool to help control bovine viral diarrhea in your cow herd. Stay tuned.
The year that we administered Multimin to the heifer's calves, we discovered that those cattle were able to, they were just a lot healthier cattle, and we just did not experience the scour problem or other problems too. It just seemed like they were a lot healthier cattle. Well, we sure feel that Multimin has been a real value to this ranch.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value. This segment is brought to you by Rotomix, manufactured in the USA and designed for feeding performance in the feedlots, beef production, dairy, and cow-calf operations.
Bob, welcome to the show.
Good to be here.
Well, it's always a treat to have you here on the show, and today is nothing different. Folks, this is Dr. Bob Larson. He is a professor here at Kansas State University's College of Veterinary Medicine. He's the Coleman Chair and of Production Medicine. And Bob, we're going to talk about bovine viral diarrhea, but
Yes.
you know, maybe we ought to just start out and just start laying some of the foundation of what BVD really
Right.
is.
Bovine viral diarrhea, or BVD as it's more commonly known, is an important disease for beef cattle, and really for a number of reasons. For one thing, unlike other diseases, it really affects all age categories. So adult cattle can be affected with this virus, very young calves, feedlot calves, so really all segments of the beef and dairy industries have to deal with the BVD virus. So that makes it important. Also, it's a fairly serious disease in that diarrhea is in its name, so you would think that's an important part of the disease, but actually that's a pretty unusual sign that we see. It's a very strong immune suppressing virus, and so we will see it as a component of respiratory disease. We see it as a cause of abortions and poor calf health in young calves, and so it really affects a lot of the different body systems, and so it's a pretty important virus for beef cattle and dairy cattle producers.
Well, sounds like it has an effect on almost any kind of disease we see, and kind of sets animals up for that by suppressing that immune system.
That's exactly right. It's an important virus because it affects all aspects of the beef and dairy industries, and it's a broadly acting virus. It's going to affect the digestive tract, the respiratory tract, the immune system, and so it's an important virus.
Numbers of animals usually affected by this?
Well, many cattle in the United States are exposed, and if it's an adult healthy animal, the disease is relatively minor. But if that animal is pregnant, it can cause an abortion, or if it's young or if it's stressed due to any other reasons, because of its ability to suppress the immune system, we see a lot of other problems. So I couldn't give you an exact number, but it's one of the more common viral diseases that we see.
Other countries have eradicated it or done eradication programs.
That's true. Particularly some of the Scandinavian countries have eradicated this virus. They had a much lower beginning level of the disease to start with, and the way that they manage their herds, very little transport, pretty much stay on the farm where you were born and raised. That made that possible, although it wasn't easy for those countries either.
Right. And then, of course, the PI calf that everybody talks about. We got about 30 seconds here before the break, but
the PI calf is a special component of BVD, the disease, and its control. You can think of the PI calf as kind of the typhoid Mary. This is a calf that's shedding just tremendous amounts of this virus, and he or she is really the source of the virus for the herd or to be passed to a new herd.
Great. When we come back, we're going to continue with Dr. Larson talking about BVD and a new tool that they've developed to help control it in your herd. You're watching DocTalk, and we're glad you joined us.
This segment was brought to you by Brute Cattle Equipment, makers of the Brute Stealth Hydraulic Chute. If the chute fits, swear by it. Visit our website for more information.
You know just how costly BRD can be, but did you know that bacteria like Mannheimia and and Pasteurella can cause BRD. That's why veterinarians and cattle raisers focus on preventing pasteurellosis with a quality vaccine like Pulmogard PHM1. It's ready to use, highly syringeable, and provides comprehensive protection with a single dose. For pasteurellosis protection that's truly the head of the class, ask your veterinarian about Pulmogard PHM1.
This hog is head over hoof for meal made from U.S. soybeans. Now, one hog isn't that impressive, but suppose we add another, and another, and another. Before long, you've got billions of hungry customers around the world all clamoring for the same thing. Our soybeans. Learn more about the billion-dollar appetite of animal agriculture at BeyondTheElevator.com. Brought to you by America's soybean farmers and their checkoff.
Hi there, I'm Dr. Dan Thompson from DocTalk, and I'm excited to team up with Vance Publishing to honor some of the youngest and brightest professionals in agriculture today. And you can help us by nominating someone you may know. If you know somebody under the age of 40 that excels in animal production or food animal agriculture, food safety, transportation, or others, you can go to DocTalkTV.com and nominate someone for this award. Help us honor those who help us feed the world for generations to come, and I'll see you down the road. Dr. Dan here. Whether I'm driving up and down the roads covering the state of Kansas, or I'm getting between Riley and Manhattan for my job, I'm driving a Ford truck. I'd like you to come out and visit my friends here at Dick Edwards Ford. They have a truck that'll suit your needs, whether you're looking for power with a Power Stroke diesel, or if you're looking for fuel efficiency with the new EcoBoost engine, they got a truck that's just right for you. They're located 2 miles east of the Town Center Mall in Manhattan, Kansas, and they'll bend over backwards to help you. And I'll see you down the road.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by Norbrook Laboratories, manufacturers of Normycin LA, Normectin Plus, 1%, and Poron, the practical choice for your herd.
Folks, welcome back to Doc Talk. I'm Dr. Dan Thompson, joined by Dr. Bob Larson, who's the Coleman Chair, and he is a professor here in the Department of Clinical Sciences at Kansas State University. He's an epidemiologist, does a lot of work with disease control, specifically with beef cattle. And Bob, when we left for the break, we were talking about the importance of BVD as a disease. And we talked about some of the other countries, but when we start to talk about other countries eradicating it, and it doesn't look like that's going to be the route for us. What has made this possible here in the U.S.?
You know, there's been a lot of work on this disease really since it was discovered in the 1950s, and especially in the last couple of decades. The companies that develop vaccines have developed some very effective vaccines that are very good at decreasing the risk of this disease in herds where they're exposed. Like all vaccines, this vaccine performs well when the challenge is low to moderate. If the challenge is very severe, such as in the presence of one of those persistently infected or PI calves,
right.
That's when the exposure can overwhelm the immunity developed by a vaccine. So the fact that we've got some good vaccines available, and the other thing that's happened in the last 10 to 15 years is some very good, accurate diagnostic tests to find that persistently infected animal. When I was first in practice, it was very difficult to identify a persistently infected or PI animal, to differentiate them from other cattle. And as long as we couldn't find them and remove them from the population, it was very difficult to control this disease. So now with the advent of good, accurate, quick tests for this animal, as well as pretty good vaccines, we really have the tools necessary to try to really control it, decrease its impact in the nation's cattle.
So you can find the super shedder type animals,
That's
get
a good
them
way to say
out of
it.
there, and control the kind of the cold,
the low levels, yeah.
The kind of the lower level transfer. Well, I know that you mentioned there were lots of different groups, professional
Yes.
societies and producer groups, but who are some of those groups that have been behind making some of this happen?
Yeah. Several of the veterinary organizations took an early and active role because this disease is so important. It's one of the diseases that affects cattle pretty severely in a lot of different ranches. The Academy of Veterinary Consultants was one of the first organizations. It's a group of veterinarians they developed a BVD committee and began working on control strategies. Also, the American Association of Bovine Practitioners and the National Cattlemen's Beef Association have also had BVD control committees. And those committees, that people that have worked on those committees have worked very well together to kind of approach this as a team effort to try to develop a lot of good educational materials and kind of directing where some of the research went.
And it led to a web page, right?
That's right. And that's one of the very first steps I think that was very helpful was bvdinfo.org is a website where some of the best articles that have been written about BVD can all be found on one site.
Well, again, that website is bvdinfo.org, and you can get good information there on BVD. Bob, when we come back, we're going to dig into that tool that y'all designed, and awfully glad that you've done it, glad that you're here today. We're glad that you're watching Doc Talk. We're going to take a break, and afterwards, we're going to continue with Dr. Bob Larson. Don't go anywhere.
Beef producers need a practical choice when antibiotic therapy is required. More than ever, they are reaching for non-prescription Noromycin 300LA from Norbrook, specially formulated to produce sustained antibiotic blood levels up to 4 days in cattle. Noromycin 300LA delivers economic, broad-spectrum disease management for pneumonia, shipping fever, pink eye, wound infections, and foot rot. See for yourself why Norbrook's Noromycin 300LA is the practical choice for your herd.
Hi, I'm Kevin Ochsner, host of NCBA's Cattleman to Cattleman and Colorado Rancher. Join me each week as the National Cattlemen's Beef Association brings you the latest updates in industry information and market news. Plus, each week we provide important educational information and features on cattlemen from across the country just like you. And we can't forget our favorite cowboy poet, Baxter Black. Join me for NCBA's Cattleman to Cattleman, debuting Tuesday nights at 8:30 Eastern, right here on RFD TV.
We started using Multimin about 4 years ago. We started out first in our own cow herd and our own heifer replacement heifer program just to see how it worked, experiment with it. We don't like to put a new product out there with our clients unless we've tried it ourselves or there's a lot of data behind it that we like. We had really good results with it our first year, really are happy with the way things worked. So we decided to start using our clients, and we have been now for 3 years, and I would say 90 to 95% of our clients use Multimin.
This segment is brought to you by Lalaman Animal Nutrition, dedicated to the development and production of natural and differential solutions for animal nutrition.
Welcome back, folks. Dr. Dan Thompson here from the College of Veterinary Medicine with Dr. Bob Larson, who's a professor in clinical sciences. He's an epidemiologist that studies beef cattle diseases, veterinarian, and he is the Coleman Chair of Production Medicine here at Kansas State University. We're proud to bring him home. The Hiawatha, Kansas native.
That's right.
is back in northeast Kansas. And we're going to talk today about your bovine viral diarrhea BVD consult. Sorry,
Yes.
I'll get spit out sooner or later. Anyway, we're going to talk about the BVD consult that y'all have developed, and so let's jump right into it.
The BVD consult is designed as a way to help beef cattle producers and their veterinarian design a control program for BVD that's really applicable to their ranch or farm, that fits exactly what they are dealing with. And it was designed to be similar to a phone conversation. All of us that work with BVD frequently get phone calls from producers or veterinarians, and there's a series of questions that we ask. So we're on one end of the phone asking questions, and then the person on the other end of the phone says yes or no. And then depending on how they answer those questions, we kind of go through a pathway in our heads of how we can best give them a control strategy. So we wanted to duplicate that, or kind of make that same type of a question and an answer type of a tool interactive on the internet. And so that's where BVD Consult came from. So a beef producer, and I'd like them to do it with their veterinarian, because sometimes the veterinarian can help explain some of the questions and exactly what goes on, but a beef producer can get on there by themselves if they want to. And so you go to the BVD Consult, which is right there at the front and center on bvdinfo.org, and you click on that, and the first question will be, do you currently have BVD in your herd? And if you know you do, you've diagnosed some cattle that have it, you just click yes, and for a herd that is positive, it asks them some specific questions about the different things. It gives you the opportunity, can you do a certain management to get rid of it? Yes or no, and then depending on your answer, go on down that path.
So basically, it's kind of a decision tree.
Yes.
Do you have the disease? Do you not have the disease? Do you want to get rid of it? Are you okay with it? Do you want to keep it out?
Right.
And then how you would manage
Right.
those.
There's a whole pathway for if you answer the question no, or honestly, if you don't know if you have BVD in your herd or not, you answer the no and go down that pathway. And it asks you some questions about the important decisions that you can make. You know, things like, do you test new cattle that you bring in? If you say, I haven't, and so I'll click no, and you'll get some feedback saying, this is a pretty high risk area. Are you sure you want to do that? And if you go, yeah, I'm not going to test, then you go down that pathway and it'll give you an answer. It might tell you that you've left some holes in the control strategy, but it'll tell you exactly where you are. If you kind of go down that pathway and it gives you that warning of you've left a big hole in your disease control, you go, well, I didn't know it was important. I could do that. So you can go back, hit the back button, click yes, I can do that, and it'll take you down those pathways. So it gives you feedback as you're going along when you're making good decisions, bad decisions, or decisions that aren't necessarily good or bad. They're just going to be specific for your farm.
Wow. Well, folks, I suggest that you go to that website, bvdinfo.org. Lots of people have been involved, and we come back. We're going to talk with Dr. Larson a little bit about who was involved in developing this and how we might apply this to other diseases. You're watching DocTalk. Thanks for joining us.
This segment is brought to you by Purple Wave Auction, the easiest, most straightforward way to sell used equipment. Purple Wave, straight, simple, sold.
This is Agriculture Today from Kansas State University. The pork industry is on full alert now for a new and serious herd disease called porcine epidemic diarrhea virus, or PEDV. Swine health experts like K-State's Steve Dreetz are advising producers to watch closely for signs of this costly disease, especially in nursery pigs.
When this virus is introduced into the herd, it's very devastating to the young nursing baby pigs. They're the most susceptible. It basically destroys the whole intestine of the young baby pig, and they're unable to take in any nutrients and causes diarrhea. Older pigs will exhibit signs of diarrhea, but usually recover.
This is K-State Research and Extension.
Cow-calf, stocker, and feedlot producers know that effective parasite control improves overall herd performance and profitability. Norbrook offers a comprehensive, economical line of pour-on and injectable parasiticides for every livestock operation. Consult with your local animal health supplier to set up a program that protects your investment and brings larger cattle checks this fall. See for yourself why the Noromectin line from Norbrook is the practical choice for your herd.
The Kansas State University College of Veterinary Medicine is a leader in food animal research and education. Our researchers are constantly expanding the knowledge of animal health and food safety. Through the Veterinary Health Center and the Kansas State Veterinary Diagnostic Lab, we provide practical services for animal producers. Home of the Beef Cattle Institute, the college is committed to animal welfare training and research. The Kansas State University College of Veterinary Medicine, knowledge and service for the future of animal production.
Got cattle? Rotomix manufactures a complete line of energy-efficient rotary and vertical feed mixers for feedlots, beef production, dairy, and cow-calf operations. Our mixers are available with the patented Generation 2 staggered rotor, the industry standard for feeding wet rations that include wet distiller's grain. Made in the USA, Rotomix mixers are designed for feeding performance that American cattlemen and dairy producers have come to expect. Rotomix, proud to offer a better mix in less time using less fuel.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Folks, thanks for coming back to our final segment of Doc Talk today. I'm joined by Dr. Bob Larson, who's a professor and the Coleman Chair here in the Department of Clinical Sciences at Kansas State University's College of Veterinary Medicine. And Bob, there were some people that were involved. In the making of this BVD consult, and I know that you wanted to give kind of a shout out to some of those folks.
That's exactly right. First of all, I guess I should say, there's been people working on this disease for 50 or 60 years, and I guess a shout out to everyone in that in that lineage of research that have really helped us understand this disease. But the BVD consult really came together because of some hard work by a group of people. Dr. Brad White and myself here at Kansas State University, both faculty members, as well as Dr. Sherry Merrill, a practitioner here in Kansas that did a lot of the legwork to get this done, really put in a lot of work. We also had a lot of help from some of our colleagues at other universities. Dr. Dave Smith at Mississippi State University, Dr. Dan Givens down at Auburn, Dr. Richard Randall at the University of Nebraska, as well as Dale Grodelution with Zoetis Animal Health, and they helped sponsor this as part of an educational grant.
Wow. It's a great team, great group of people. I'm very fortunate to know everybody on your team and that. But, you know, the thing that interests me, we mentioned before we started the show that this could be a decision tool or a tool that could be extrapolated in many diseases or many different things. And how do you kind of vision that?
I really think this has the potential to be the way to teach disease control both to veterinary students as well as a good way to interact with producers themselves. In that, as proud as I am of the BVD info website that has brought all the really good research papers into one location, but to really get good out of that, I'd have to read all those papers and digest them and understand them. The concept behind a BVD consult is, as a veterinarian, I know the things that are most important to make a decision. You know, where you get your animals, what you're able to do vaccination-wise, things like that. So when I ask specific questions about that, then if I use the research to guide how does the best answer move from there, you can avoid having to send somebody to read a large number of really scientific papers, and instead we move them to the questions that we want to ask about the management that they can do or implement at their ranch. And then those of us at the university have read the papers and then used that science to then give the best answers, but we don't require people to go read all those papers. We've just kind of made it the decision points, the things that people can implement at their ranch, and so we think it has a real power to take all the work that those scientists have done and really boil it down into the action points.
Translation from the bench to the field.
Yeah, exactly right. And there's no reason to stop with BVD. There's a lot of diseases that cattle face, a lot of management decisions that would work really well with this decision tree, the series of questions that we ask. It would work well for a lot of different diseases.
Well, we appreciate you not only being on the show, but everything you do for a lot of different people.
It's good to be here. Thanks a lot, Dan.
Thank you. And thank you for watching DocTalk. Remember, we always want you to work with your local practitioner, and this BVD consult will be a great tool to break out and visit with them about. If you want to know more about what we do here at Kansas State University's College of Veterinary Medicine, you can find us on the web at www.vet.ksu.edu. I'm Dr. Dan Thompson. You've been watching DocTalk. We're sure glad you joined us, and I'll see you down the road.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
DocTalk, produced in cooperation with Drovers Cattle Network and Bovine Veterinarian. For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Multimin USA, manufacturers of Multimin 90, sure trace mineral supplementation by timed injection.
I'm Guy Collier from Collier, Hereford and Angus at Bruno, Idaho. We're calving approximately 500 head of registered Hereford, Angus, and have a fairly large recipient herd where we're doing quite a few embryo transplants as well. We've raised Hereford cattle all of our lives. Started out as a commercial program. Mainly started in the purebred business in '72 in a big way. I've served on the board of directors for the American Hereford Association. We show cattle on a national level at Reno, Denver, and Fort Worth. Been fortunate enough to produce several championships at those different shows, and we started using Multimin 3 or 4 years ago. Multimin is one of those products you can use to get the ultimate performance out of cattle. Around 90 to 95% of our calves are either AI or embryo transplant. Since we've started using the Multimin, we're up around 70 to 75% conception on our first AI service. Anytime that you're able to supply a product like this that can boost the immunity system, get a better response from your vaccines, it kind of fits into a total program. Multiman is one of those products that you know that you can use and you know that it'll be cost effective, and a product like this is very beneficial for us.